Hi, I'm Justin Ezekowicz from the University of Alberta, and I'm pleased to co-chair with my co-chair Doug Lee from the University of Toronto Work Package 2 for our NCE Transform HF. We're excited to be part of this NCE because our work package really tests whether or not some interventions, pragmatic or otherwise, can really change the care for patients with heart failure. Our job is to really look at the risk factors and outcomes of patients with heart failure across Canada and delve into the wealth of data we have already in Canada and create new data in terms of how we put it together so we can evaluate all risk factors, treatments, and clinical outcomes for patients with heart failure. One of the things we're going to tackle is some of the interventions that we can do. So do we want to test A versus B, or sometimes test some things that are in practice already, as well as testing new therapies that are just coming online now. We also want to test interventions that go into people's homes, technology, ways to follow patients, whether or not a biomarker or a blood test can make a difference, or whether or not just following their home care can make a difference. These are all types of interventions that are required for the care of patients with heart failure because no one single intervention will cure a patient or be the right thing for every patient. One of the things that we've recognized is we are experts in Canada looking at administrative health data or population level data, but we really need to get 2 or 3 layers deeper than that and look at the blood tests, imaging tests such as ultrasounds, and other care-specific items in terms of heart failure. So for the average patient, they may see a physician or nurse or healthcare practitioner and get a number of blood tests or echocardiograms, and we need to be able to describe that in a lot more detail than we've ever been able to do before. The NCE will allow us to get into that greater detail and do that nationwide in a real-time effort so we can identify which risk factors progress and which ones don't. What are the clinical outcomes of those individuals when we describe them in very much detail that has not been done in Canada before. But we're really building off Canadian excellence in the field already. So we have a huge opportunity to transform the entire nation in terms of their care for heart failure.